So now I'm sitting there chugging water. It never felt better when I was that hydrated. So when I was actually getting my gallon of water in every day, I felt at my best simply because I was hydrated. And that's how important it is. And now that I'm done, I finished that about a couple weeks ago, I can be honest and say I have not even come close to getting 1 gallon in a day. And I do feel different. I mean, I really do. So hydration is key. If anybody says to me I'm chronically fatigued or I don't feel good, the first question I have is how much water are you drinking in a day? And I can almost guarantee that the answer is not enough.
This is StRest. I'm Kerstin Lindquist, health coach, author, and Emmy award-winning TV host. I've committed to helping people reduce stress through impressive health science, attainable mindset change, and biblical truth. Let's have a real conversation with zero judgment and endless solutions that you can use. You aren't alone. You can do this. Let me help you reduce stress and make room for rest.
Hey, quick break. Are you feeling your age a little bit? Joints or maybe brittle hair or face, skin? One supplement can address all of that. It's collagen. And my favorite by far is Ancient Nutrition. Collagen is the most abundant protein in the human body, so we need it. And Ancient Nutrition is my favorite because it's made from real quality ingredients that I know that I can trust. In just 2 scoops of their multi-collagen protein, you are getting 20 grams of protein to help support your hair, your skin, your nails, your joints. And as an added bonus, you're also getting vitamin C and probiotics. That's for gut and digestive health support. It's the perfect addition to any beverage. You can put it in your shake and things like that, but also overnight oats, baked goods. But I put the unflavored multi-collagen protein in my black coffee every single morning. It's perfect because it mixes really easily and it's virtually tasteless. I especially also love their strawberry lemonade because it's very super refreshing in the summer, but whatever, you need to get your collagen. Multi-collagen protein is more than just collagen. It's real results that you can see and feel from ingredients that you can trust. That's why I'm talking about it. Right now, you can get 25% off. You go to ancientnutrition.com and put in the code STREST25. That's STREST 25. STREST25 at ancientnutrition.com. And that's going to get you 25% off site-wide. Make sure you grab my favorite for the dark coffee, which is your multi-collagen protein, but then also try something else as well. You're going to love it. That's STREST25 for 25% off. Get your collagen. Hey friends, I will say this next episode is one of the topics that I get kind of a lot of controversy on social media. We are going to be talking about IV hydration therapy. That's when somebody comes into your house or you go to one of those places and you get your nutrients via IV. It's been around for a while, but it's getting a whole lot more attention these days because it is so beneficial. And not just if you're sick, not just if you're recovering, but truly day in and day out to help you stay healthy, energized, and we talk longevity as well. I have in this show, Dan Continenza. He's the CEO and founder of IV Active. He's an avid endurance athlete. That's how he got into this business. He's a committed husband and a busy father of 2 boys. So he understands the importance of optimizing health to be able to perform at the highest levels at all time. Whether for you that is running and exercise, or maybe it's just being able to stay on top of your life and your work. We're going to talk all about what type of nutrients is good for this and also who should and shouldn't do it. And we're going to demystify some of what people might think about getting IVs at home. Sit back, listen. It's time to learn all about hydration therapy through IV. All right. Well, let's jump right in and talk about what is IV therapy.
Awesome. So big question. So I can talk about what it is, and then I can talk about what it isn't as well, because there's definitely a lot of myths out there and, a lot of misinformation regarding what it is. So IV therapy, and we're referring to IV hydration therapy, sometimes also referred to as IV vitamin therapy. A little bit different than home infusion therapy, which is something that I have experience with having worked in the home health world. So what we're doing in our version of IV therapy, IV hydration therapy, is we're going out and seeing patients that, are suffering from a lot of different things. And I try to bucket into a couple different categories. A lot of times we're seeing people that are have basic dehydration issues. They might be suffering from an acute illness like a flu or a neurovirus or something like that. And they're experiencing a bunch of symptoms. So pain, dehydration being the big one, upset stomach, trouble sleeping, migraines, you name it. So we can address a lot of those acute illness symptoms and concerns through what we do. And then also chronic conditions. So, we will see cancer patients that are dealing with, they might be going through chemotherapy and they're dealing with the fatigue from that. There are some experimental treatments out there with high dose vitamin C, which I could go down a rabbit hole with the science on how that works. But there's a lot of different patients. Now, we also work with athletes from a performance and recovery standpoint. So there's so many applications for what we do.
So I know the answer to this because I do this and I love it, which is part of the reason why I have Dan on the podcast is I get a lot of questions about it and why do you do it? But one of the questions I get that always surprises me is people say, is this safe? Should we actually be doing this?
Absolutely. I want to first state that we are a legitimate medical home healthcare practice. So, we have a medical director with over 20 years of experience, specifically in emergency medicine, very applicable to what we're doing. A lot of our patients that we see usually have a choice to make at some point. Am I going to go to the ER or am I going to stay home and have one of our nurses come? So, in that specific situation, a lot of people want to stay home. So, all of our patients go through a medical history screening process when they first come aboard, just like you would if you were going to a PCP office or any other specialist. We do a medical history exam. We have a nurse practitioner run through a screening, and then we clear our patients for services. So we're looking for things like any pre-existing conditions, things like congestive heart failure, any type of kidney disease, and specifically also allergies, because, most of what we have is safe from a vitamin and nutrient and mineral standpoint. However, some people do have, allergies to certain things. So we screen for that. And then every patient gets an order for service. So it's no different than, typical home healthcare, home infusion type of thing. So very safe. And then the nurses that come out, our company specifically only hires nurses with a good 2 to 3 years of IV experience, whether that's in the emergency room, doing some sort of inpatient or home infusion, outpatient infusion, or critical care. So those are the best types of nurses. They have a lot of experience. I joke all the time that, our team of nurses could do IVs blindfolded. That's how good they are. So very safe, very, very safe. And a lot of what we're using is, like I said, vitamins, minerals, other nutrients, and some basic medications to help address symptoms. So very safe.
Yeah. Anecdotally, I have kind of difficult veins every time, if I've ever in the ER, I've had surgery, or I do blood work all the time because it's kind of, I don't know, it's a hobby. It's not a hobby, but it's my job as a health coach. And I love the data, and I have hard veins. And these nurses that I have used with IV Active have been amazing at getting in and staying in. And I've been so happy. We're talking about IV Active, which happens to be, we're outside of Philadelphia, and that's kind of the local, it's around here. They come to your house. It's the one that I use. However, there is mobile IV elsewhere. There is also, you can go to these places now and get IV therapy, just like you can do a cold plunge somewhere, or you can do red light therapy. So for everybody listening, this is one more way to either get and stay healthy, to have an alternative to, if maybe you're not compliant with your supplements, to biohack your health. I just think that it's amazing that we live in a world now where we can have this come to us. I mean, it used to be if you needed to get an IV, you were in the hospital, Dan.
Absolutely.
And now it's so convenient.
One of the reasons that I got into this is because of my experience in home healthcare. I've worked in home healthcare for a combined total of 12 years and always been very fascinated with the ability for someone to receive healthcare services in their home.
Mm-hmm.
A lot of what I did in my prior life was a lot of skilled nursing, pediatrics, and adult. We'd have caregivers go out and help with activities of daily living, and all the way up to really high tech, like patients that were on respiratory equipment, feeding tubes, all that stuff. And I always had a big fascination for being able to receive healthcare in the home. So that's one of the motivations for why I kind of went into this, is that plus the whole proactive wellness and biohacking thing, also a very big interest of mine.
Yeah. So I think let's break it down into a couple of different groups of people who this might be great for. And I'm going to start with, you mentioned somebody who's going through something, whether it's chemotherapy or recovering from surgery. I always tell all of my clients, if they know they have surgery coming up, knee replacement, hip replacement, anything. I had surgery for endometriosis. The month to 2 months before, you train like it's a freaking marathon. You get your body ready. So I think that there's those people who benefit before and after surgery during treatment. What type of IV are they getting?
So we're, from a recovery or preparation standpoint, we're doing treatments with multiple different types of vitamins. So we have our B complex vitamins, which are good for overall health. Anybody that's preparing for a surgery or recovering, amino acids, they're the building blocks of protein. So we really highly recommend that. We actually have a specific post-op surgery treatment, which
Oh,
also
that's great.
includes anti-inflammatories and things that are going to help with swelling after the fact. And then the hydration is the biggest part as well. I mean, just being able to stay hydrated. It's amazing what the body can and can't do when it's either hydrated or dehydrated. There's so many symptoms that come along with dehydration. And most people, I think the estimates about 75+% don't drink enough water on a daily basis at all. So that's what we would do to prep somebody, make sure they're hydrated, make sure they have all the nutrients that they need. And then afterwards, really focus on the anti-inflammation and get that swelling down.
95% of US adults over the age of 50 are dehydrated.
Yep.
That was the latest statistic. Like it's ridiculous. I am 47, but I would say in the last couple of months, before it was always, oh, drink your water, you have to have it. But now I feel like I can feel the dehydration in my skin, in my body. I'm having to try harder. And different parts of your body will literally shut down if you're not hydrated enough. And water is boring. I get it. So I think just for the hydration piece alone, and I'm pretty sure this is going to air, sometime early summer, the heat of the summer, I mean, just for that piece alone, it's worth it.
It's interesting. I just got done doing 75 hard. I don't know if you're familiar with that. It's like a workout. It's more of a discipline challenge than it is anything else. And one of the parts of the whole thing is you have to drink a minimum of 1 gallon of water a day. That's really hard. Like, it's really not easy. There's a reason why there's now bottles that count your sips and all these things to help you track your water intake. I mean, it was hard for 75 straight days. I was chugging water. And there were some times where I get to 8, 9 o'clock at night. I'm like, oh, wow, I have 25%. I'm short. So now I'm sitting there chugging water. But to bring it all back is I never felt better when I was that hydrated. So when I was actually getting my gallon of water in every day, I felt at my best simply because I was hydrated. And that's how important it is. And now that I'm done, I finished that about a couple weeks ago, I can be honest and say I have not even come close to getting 1 gallon in a day. And I do feel different. I mean, I really do. So hydration is key. That's like if anybody says to me, I'm chronically fatigued or I don't feel good, the first question I have is, how much water are you drinking in a day? And I can almost guarantee that the answer is not enough.
Yeah, absolutely. Let's then talk about women specifically. We, especially going through perimenopause and menopause, have more needs. And you know what? We could also talk about pregnant women, or, there's a lot of times in our life when we have more needs. How do you tailor some of this to women?
Yeah, so we have a couple different treatments that we actually recommend. So we have a women's health treatment that's really going to, with that, there's additional amino acids in it. There's a lot of nutrients that women need at certain points in time of their life. Pregnancy is actually a big one for us. We get a lot of calls regarding pregnancy and really related to, hyperemesis, the constant vomiting, the morning sickness. We can actually help with that considerably.
Wow.
A big part of that is dehydration.
Yeah.
But not only just dehydration, it's, dealing with the nausea that comes along with it. We actually just yesterday, we had a call, husband called us panicking because his wife, she's constantly sick when she wakes up. They got used to going to the emergency room and didn't realize that, they could have a nurse come out to the house under the supervision of a doc, and we could actually treat somebody that's pregnant that's going through that. And they were extremely thankful that we were able to come out on a Sunday morning on Mother's Day, nonetheless, to help her out. It's a scary thing. The vomiting, the dehydration, it's a scary thing for women either going through the first time or second, third, fourth time. But this, that's a big bucket of clients that we can really help out is going through that specifically.
What a gift it would be if you're somebody who has, a daughter-in-law or your daughter or who's pregnant, to gift them this type of thing to support them during those 9 months. I think to be able to stay in your own house, I mean, that's part of why I love it so much too. The last time I had one, we sat outside and I could do a little bit of work while I was getting my IV. But to be able to stay home and not have to go to a hospital or go to a clinic, and what a change it is now, because I even tell my kids, if they're sick and they're not eating and drinking, we're going to end up in the hospital and they're going to have to put an IV in you. And that's really what happens a lot, is you go to the ER and they just have to get you rehydrated, whereas you could stay at home and do that.
Absolutely. I can't tell you how many times we've had patients call us after sitting in the ER for a good 6 to 8 hours, and they've come to us basically, and we give them some hydration, some vitamins and nutrients, and some basic medications, and we got them back on their feet within a few hours, when previously they would have just sat in the ER for an entire night. So, and I just want to mention too that not every patient that goes to the ER is appropriate for our services, but I
Of
can tell
course.
you an overwhelming majority of them, really all they need is some fluids and some, maybe some pain medication and something to handle some nausea, and they're going right back home. So why not stay home? We can come see them. They can stay there in the comfort of their home. We'll get them feeling better, and they'll be able to move on and, go back to work, go back to their activities. We also, interestingly enough, we have here in Erie, we have a lot of people come in the summertime, beautiful place in the summertime. So traveling, think about it. Would you want your vacation ruined because you're sick and, you're throwing up and dehydrated? So we actually see a lot of tourists that actually come out here to vacation, and we'll come see them in their hotel as well. So it doesn't just have to be home. It could be
Right.
anywhere.
Well, then that was going to be my next kind of group of people. The very first time that I ever got one, it was before I was getting on a European flight. And my kids had been a little bit under the weather, and I felt like maybe it was trying to get me. And I'm like, absolutely not. We have saved and planned for this trip for so many years. I am not going to be sick. And plus, travel does that to you, right? How many times do you come back home sick from travel? So that's a great time to do this, is before or after.
Pre-trip, post-trip is what I usually
Yeah.
say. So, get the body ready, give it the hydration, the vitamins and nutrients that it needs for a stressful trip. And I know, one of the big goals for your podcast is about stress. So,
Yeah.
the body goes under incredible amount of stress when traveling, especially when you're going out of time zones
Mm-hmm.
or going overseas. I mean, that time change will do you in.
It'll get you.
I went out to Arizona, so we're talking only 3 hours. But that 3 hours on the way back into, Pennsylvania was brutal. It hit me for a few days. So what did I do? I had one of my nurses come visit me and give me an IV, because I'm a believer in it. And boy, does it help massively when it comes to, helping with the recovery on the way back from a trip. But
Yeah.
also could be used for pre-travel as well to help, get the body ready and make it as strong as possible. And the hydration as well.
Yeah, absolutely. The first time I ever saw an IV out of like the doctor's office was at one of those, stores that you see popping up where they do all the different biohacking things. And then I remember going to Vegas, and they have them in Vegas everywhere for a very different reason, I hope, than what people are watching this podcast, listen to this podcast for. But it makes sense, I guess, if everybody's drinking like crazy because you get dehydrated.
Absolutely. And one of the things that I see often is when I ask people or talk about, IV therapy or what our company does. And the immediate thing is, oh, you treat people with hangovers. Yes, we can. It is very effective to give somebody fluids and some medication to deal with that hangover, but it's a small percent of our population. I personally am not a drinker myself.
Yeah, me
So I
either.
didn't want the company to be really based on that concept. However, it is one of the populations of people that, we can help. That's why you see them in places like Florida Keys, Nashville. Talk about any place where people are drinking. Vegas, that's the biggest one. But, it's a small percentage, and,
It works.
it works. I mean, I'm not going to deny it. It works.
And you didn't think of naming the company IV Party Active or anything like that. So I feel like it would be fantastic. Bridesmaids, like you have this big event coming up. Nobody can get sick. Let's all sit around and do an IV together and spend some time while we get our hair done or something like that. Parties. I know that it sounds maybe a little odd to some, but not if you're in my world where I am so focused on health and wellness. This would be such a great party.
Absolutely, and it doesn't have to be like a recovery party. So,
No,
we've done wedding parties prior to the wedding to get ready for the
that's what
big
I'm
day.
saying.
We've had brides actually call us the morning of their wedding and say, "Oh my gosh, I'm throwing up. I don't feel well." And we've gone out and we've actually treated so they can get through the ceremony. And then obviously after the celebration, the reception, we'll see people the next day.
Of
But
course.
there's nothing abnormal about getting together with a group of friends and doing a wellness activity where you're all sitting around, you're enjoying. We can do treatments for everybody. So an IV party sounds interesting, but it's actually a really great activity for people to get together. It could be a corporate bonding experience if you have employees. It could be just about anything, and that kind of ties into the whole proactive wellness part. A lot of what we've been talking about is response to illness or symptoms, but proactive. That was another reason I was really interested in this industry, is the ability to make some educated choices about your health through IV therapy as a modality, and be able to really focus on how can I increase my performance? How can I stay active? How can I really address, some of the things that you might have going on that you'd like to improve on? So we can do parties, wellness parties.
Wellness parties. I love it. So a big group, at least in my world, I remember being at, because right now we're recording this in May, which is all of the games for the kids and all of the assignments are due and all of the parties and all of that kind of thing. So it's a big time for moms, dads too, if you're really, really hands-on. And I remember being at a baseball game going, wow, I feel like all of these moms after these baseball games and soccer games and all of the things you're doing running around with your kids, you don't have time to get sick. I feel like this would be so good. Just kind of as your self-care. Maybe you don't have time to go to get a massage or get your nails done, but you can have somebody come to your house and give you the nutrients that you are depleting because you're caring for these little people nonstop.
Probably not drinking enough water. It's the interesting thing about parenting. It's like the only job out there where you can't take a day off. Like there's no days
No.
off, and your busy moms are wearing themselves out. I mean, one of the things that we highly recommend is immunity treatments. Boost up those B vitamins, a nice dose of vitamin C, very important for immunity, zinc, magnesium, all the things that are really important for keeping you healthy. And I think one of the other things that people tend to look past is the importance of sleep. We've had a lot of patients come to us and say, I'm not sleeping well. And we can actually formulate treatments specifically with magnesium. It's a really important nutrient when it comes to helping with sleep and calmness and really relaxation. So we highly recommend treatments, not only for immunity, but also to assist with sleep, healthy sleep habits. There's a lot of other things that go into that, but being hydrated and having the right nutrients is important for sleep.
Yeah, you are speaking my language. Everybody go back and listen to all of the sleep episodes that we've done, because I truly feel when it comes to your health and wellness and the four main components, which are eat, sleep, move, and then relationships and spirituality, the one that I work on with health coaching clients is sleep, because you're not going to that's where your body and your brain heal. So you're not going to be able to get to any of your goals in the other areas if you're not getting a good enough sleep. So then let me ask you this. Do you do a treatment should you do it in the evening to help you sleep, or is that not how it works?
Really, it doesn't necessarily matter because we're not necessarily giving a sleep aid. Like I think a lot of
Yeah.
people would associate that with like taking like a Tylenol PM or a prescription
Don't do
like
that, please.
Ambien or something
Right.
like that. Yeah, don't do that. You could get treated in the morning, and what we're really doing is replacing, those nutrients that you might be deficient in. And I'll go into that a little bit because I do recommend blood testing. You had mentioned that earlier about doing labs, and those are fun because you get to see what you're deficient in. So I highly recommend that.
You see that? See what I have to say on the podcast? He just said labs are fun.
Labs are fun.
This is a rare group of people. We just love this stuff.
We want to see the numbers. I think,
We do.
for me, not to get off track, but, I want to help people dial in to where they
Yeah.
actually are at today, and then be able to look, a couple weeks, a couple months down the road and look at where we've improved. I think one of the things about the IV industry is, our company, we try not to be a one size fits all. We really want to help people dial into where they're at, what's their deficiency. We know that 75% or more people are deficient in vitamin D, especially in the Northeast.
Yes.
We know that an overwhelming amount of people aren't getting enough B vitamins in their diet. I mean, the US diet, while I see a bright future, we're still in a position where there's a lack of nutrition. And, the only way to tell is we could go anecdotally by what are your symptoms? I have brain fog, fatigue, yada, yada, yada. But really the labs are what's going to tell us, the truth, like what's going on. And then another big area of that is, NAD. It's a big 3-letter word right now. Everybody's really interested in it, and it's important because as you get older, your NAD levels drop, and that is a vital part of cellular health and how your cells function and produce energy, which then leads to every other bodily function, which is impacted by that. So, one of the things we're really looking at doing is we can now do NAD testing. So we can actually tell someone what their NAD levels are and then be able to put a treatment plan together on how to combat that through both IV therapy and also oral supplementation and other things. So I could go down a rabbit hole on labs.
Okay, well, I would actually, that was one of my questions. I'd like to double click on that here for just a second on NAD, because it is something that we're all hearing about. What is it? Why do we need it?
Yep. So it's basically everybody has NAD in their body. It's something that's in the cells. And really at the end of the day, if I want to keep it, very simple, it helps the body produce ATP, which is ATP is energy. I mean, energy is what you need to function. And, what happens over time is that NAD, decreases with age. So they usually say by 40, your NAD levels could be as low as half of what they were prior. And the only way to boost NAD is through supplementations. There's a couple different really neat products on the market right now. So NAD Plus is the traditional version where you can take oral supplement. We do NAD IV treatments. Those are the two primary ways to receive it. But also there's now a new product on the market called Niagen. And Niagen is, the letters are NR. It's the precursor to NAD Plus. So anybody that's had an NAD IV or injection can probably tell you that there's some side effects with that because the molecule has to break the cell wall and get into the cell, a process by which creates symptoms. So a lot of people experience like chest heaviness, mild headache, racing heartbeat, things like that while they're receiving a treatment.
When you do that, though, so if you do that, should you be concerned?
No. So it's normal. So those symptoms are
Okay.
normal. And how we handle that when we're doing a treatment is we titrate up the speed, the flow of the IV until the patient tells us, hey, starting to feel some symptoms. Then we usually back it off to a comfortable level. And this is why you can't run an NAD IV treatment at full bore as fast as you can, because the body's actually interacting with the NAD that you're putting into the body. It's an active process on the cellular level. But this new product, Niagen, they claim to boost NAD levels in the body 20% faster than traditional NAD plus without any symptoms. And it's because it's a smaller molecule. So it easily passes through the cell wall, and it's a much more ideal way to boost NAD levels. And that, they make that an IV treatment, which we do offer. And then you can also get an over-the-counter form of Niagen in a pill form, which you can take. And I usually recommend, that as a daily supplement, and then do an IV once a month, twice a month to really boost those levels. And you'll notice a big difference.
We'll be right back. Don't go away. It's just getting good.
I do not really have much makeup on, a little bit of lip gloss, and my absolute favorite, Dr. Deness Skin Science. This is her Tinted Defense Day Cream SPF 40. You can see by my bottle that I use it every single day, and this is the supersized bottle, which is what you absolutely need. It gives me the protection that I need because it has SPF. It gives me the blur because it has those pigments. But most importantly, like all of Dr. Deness's skincare products, they actually work. She uses the most of the efficacious ingredients, and they're all clean. I wouldn't talk to you about anything in your skincare or your beauty that wasn't clean beauty. This brand really has changed my skin. Listen, I'm 47 years old. I need a little extra help. I'll tell you where to start. Other than the skin defense, you're going to need HydroShield. Oh my goodness, the hydration. It has changed my deeply dehydrated life and makes it look like perhaps I got all the sleep and I have no stress and I didn't cry in the bathroom after my kids went to sleep at night. It really, really works. Everything does. And with clean beauty. And because we want you to have your own midlife glow up and be able to be, I don't know, maybe makeup free from time to time like I am right now, Dr. Deness has given you a little something off. Go to doctor-deness.com and use the code STREST. That's STREST for a discount. You'll thank me later. Now back to the show. should you test your NAD levels before you get an NAD IV, or is it not necessarily?
It's not necessary, however, highly recommended, because just as with anything, if you're not deficient in it and you get it, it's not going to do much for you. And I'm a believer in, we don't want to take people's money. I think
No.
we want to give people a solution that's going to help them with their goals, whether that is illness or it's proactive wellness. We want to make sure people know where they're at and then be able to get to where they want to be. And the only way to do that, again, like we said, labs are fun. The NAD test is very simple. It's a finger prick. That's all it is. You can do it at home. Send it in. You'll get your levels back, and then you'll kind of have an idea of where you're at. And if you're low, we can put a treatment
Could
plan
help.
together for you, and then get to where you need to be.
But if you're over 40, you're probably low.
Most people are. So, if
Yeah.
you're over 40 and you're wondering, dealing with brain fog, I feel tired, I'm not performing at the same level as I used to. All those things are signs that you may want to get your NAD level checked. And it's a very simple process. We can do it. And we can have a kit sent to your house. You do it, send it in, and then we'll know. We'll know how to move forward.
How quickly after an IV or supplementation are you going to start to feel the effects of NAD?
Yeah, so most people experience the effects almost right away. You
Wow.
can expect to, everybody's different, everybody's body's different. Again, if we're not sure if you're actually deficient in NAD, you may not feel a ton of anything. One of the interesting things about NAD is it's really a great anti-inflammatory. So anybody that's dealing with like a little bit of swelling or an injury or anything like that, typically the NAD is going to help. With its anti-inflammatory properties, and it's going to help with that and help with recovery, which is amazing. I mean, I do it myself on a regular basis, and I mean, I can attest to it from, personal experience.
So let's go back to the supplement, which is all the NAD stuff is so interesting to me. And I love that you were able to explain it. So thank you. Let's go back to the supplements, though, in general. It's always this balance. First and foremost, you can't like out supplement a bad diet and sleep and too much
Never.
stress. Always you need to start with the basics: eat, sleep, move, relationships, and spirituality, which is part of the reason why I listen to the podcast and you come to me for health coaching and things like that. So that's what we have to get first. But I do believe in supplements. There are certain supplements that I take that I think that most people should probably be on. Can what IV Active does be a alternative to taking all the supplements? Like, are you getting a dose high enough that I can say, well, I can not take my magnesium for a couple of weeks? Because I do have clients who just aren't compliant. Like, you should be taking this every single day, and they just aren't.
What I tell everyone is that we are not a standalone option for supplementation. What we do, which is the great part about it, is we can give higher doses. They're going to be 100% bioavailable because it's going right into the body. But I always tell people, combine this with a supplement routine, whether that's taking a daily multivitamin, whether that's doing amino acid supplement that you're using throughout the week. Like, we're not a standalone. We're there to help people get a boost and then maintain ongoing. If you want to pay us to come out and do an IV on a daily basis, we could do that. However, I don't know very many people that want to get stuck with a needle on a daily basis. So
every single day.
yeah, for us, so we can do a lot higher doses and concentration with different things like vitamin C and your B vitamins and all of that. I really do recommend healthy diet is huge. An IV is not going to correct an unhealthy diet. That's very true. And, you're not replacing all of your supplements. I highly recommend, one, do some labs so you know what you're deficient in. And then number two, we can put a plan together for you for it to make sense.
One of the questions that I ask every single guest is, do you have, like, what are your favorite supplements that you take, especially being the IV Active guy, the guy who gives people these? What do you take on a daily basis that you think is good?
I'm a big believer in a lot of different things. So I take multivitamins orally. I mean, not to take away from the IV piece, but I do an IV at least once or twice a month, typically with NAD in it, because I am 40. So I'm at that age where those NAD levels are dropping. Also a big believer in glutathione. Glutathione is the body's master antioxidant. So that's going to help reduce, free radicals in the body, help flush you out. Very important supplement. I recommend that everybody does a little bit of research on it. It's not in a multivitamin, so you're not really going to find that unless you're specifically buying a glutathione supplement, and it's not very effective when taken orally. So we highly recommend that to a lot of our patients. And one of the things that you're seeing now with the GLP-1 craze, and I'm sure there's probably people listening that are either on it or coming off of it,
or thinking of going on it.
rapid weight loss to the tune of what we're seeing people lose with GLP-1s creates a lot of waste byproduct in the body. So there's a lot of toxin buildup within the body that can't go anywhere. When we have a detox treatment specifically with glutathione and higher doses of vitamin C in it to help with the detox process, highly recommended for people that are on GLP-1s that have experienced rapid weight loss, really to help the body kind of clean itself out. This is something I learned from Gary Brecka. He has some information on that. I absolutely love the guy because he has such a wealth of information, both in like the nutrient world and biohacking and all of that stuff. So glutathione's a big one. That's a really big one for me that I really, really highly recommend and use myself. Other supplements I use that are not related to IV, I'm a big believer in creatine, actually. It's a big, really important supplement for anybody that's active, not just for things like weightlifting or sports, but really brain function, mental health as well. So, but multivitamins, your B vitamins, vitamin C, all those things. And I highly recommend to everybody vitamin D. Vitamin D is so
Should be number
crucial
one.
for immunity, sometimes referred to as the mood vitamin, really contributes to mental health and mood disorders. It's very common for people with mental health and mood disorders to be deficient in vitamin D. So I highly recommend looking at that one, getting checked to see where you're at. Can almost guarantee you're going to be low because most people are.
Yeah, it's so true. When a nurse comes to your house, what does it look like? How long does it take? Walk me through it.
So it's not scary. So that's the first thing I want to let everyone know. So once you get through the booking screening process, and like I said before, everybody screens with a nurse practitioner. So they're going to get on, they're going to talk to you over video, typically about your health history. Do you have anything going on? Make sure you're cleared for services. We're very, very careful because there is a select group of people and population that we can't treat due to concerns of fluid overload and some other things like blood clotting disorders and things like that. So when the nurse arrives, like I said, we only hire the best, both from a skill set standpoint with really good ability to do IVs, but nurses that are really interested in this world of health and proactive wellness and all of that. So our nurses are obviously they're gonna greet you. They're very friendly. They're gonna do a little bit of education, talk a little bit about the treatment that you are interested in, and even make some recommendations based on conversation. So they're gonna talk a little bit about your health history. Make sure you're comfortable, most importantly. And then they'll move forward with the treatment, and they're spending about 45 minutes to an hour with you. I think that relationship is so important. And that's one of the biggest things I learned about working in home healthcare is the relationship between the nurse and the client in the home setting or hotel setting, workplace setting, whatever it is incredibly important. And that's something we talk to all new nurses that come on board with us is, there's a customer service aspect to it. There's you're seeing people sometimes that are at their worst. Compassion's the big word that I would use, is that we have a team of compassionate nurses who really listen and care about our patients. So that's what the experience is like with our team.
Yeah, it's so true. And it's very personal. I mean, they're in your house often, or maybe they're at work or your hotel room, and they've all just been very kind, and just really a really great experience. I love that we live in a world where this is an option, that you can get something at home and make this as easy on you, sometimes in a rough time. And that was actually another category of people. I talk a lot to women specifically, but men too, who are going through extreme times of grief. Maybe they've been caregiving for a family member for a really long time and they've lost that family member. And those times of extreme grief, it's all connected, friends. You're not sleeping, you're not eating right, you're not moving, your body is under so much stress. This is the time when you need to give yourself that gift of added nutrients. This is the time when bringing somebody into your house, and again, a really kind nurse who is going to be there for you during that time. That's the self-care that you need when you're going through extreme times of grief.
Absolutely. You answered the question. I mean, that's what happens when you're going through a hard time. I mean, what are the things you ignore? You ignore taking care of yourself. And that's typically not eating, not sleeping,
Mhm.
not hydrating. And we already talked about how important that is. And
Yeah.
sometimes, like, this is off the topic of treatment itself. Sometimes you just need a friend. I mean,
Mm.
our nurses are so good. We have had, I remember a specific lady about a year ago here in Erie. She had lost her husband. She was very, very sad and very, very upset. And our nurse called me after the fact and said, I really appreciated doing that visit because that lady she needed somebody not only to help with a treatment and all of that, but she needed somebody to talk to. Again, that goes back to you're in somebody's home. It's a very vulnerable experience, but you want it to be comfortable. And I think one of the things I pride myself on with our team is that we have such compassionate caregivers, compassionate nurses that really care and listen. And, sometimes, 20, 30 minutes just to get it out is important. So it's just a human aspect of what we do as well, which is incredibly important. And I care about it a lot.
Yeah, you can tell. At the end of every keynote speech that I give and every coaching session that I have, I always ask people, okay, what's one or two things that you can do? Because usually when I'm doing these things, like I'm giving you tons of information, it's like drinking from a fire hose. You could do this, you could do this, you could do this, da, 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 da. And I know that you get overwhelmed. And so I'm always asking people one or two things that you can do. Can you move bedtime a little bit earlier? Can you get up first thing in the morning and get first light? Can you just drink more water? And I feel like this being able to pick up the phone or go on the internet and call somebody to come in and spend 45 minutes with you and give you the nutrients and the hydration that you need is one of the easiest things that you can do. Honestly, I know it's hard to maybe go lift weights for a half hour, 5 days a week. And I know it's hard to completely change your diet and even hard to drink all the water that you want. But this is such an easy one. Interestingly enough, a lot of people that I talk to in my life are QVC guests and hosts and celebrities who are love them to death, abusing their bodies because they're up all night and then their hours are weird and they're not sleeping. And then our green rooms are full of junk food. And this is one of those things that they will do that I will talk to them about all the time because it's easy. I can't necessarily get you to go to the gym, but I can get you to get somebody in your house or your hotel room and give yourself an IV.
We deem those high performance individuals. So, we've seen a lot of those, whether it's athletes all the way up to the professional level. We've treated some famous musicians who are on the road on a tour bus, 300 some days a year, probably not sleeping well, performing every night, every other night. Real estate agents that are just hustling to, do transactions and help people find homes or sell homes. I mean, they all fall into the same bucket. Executives that, work at large companies, everybody's beating themselves up. I mean, that's our
Yeah,
culture too. We could go on a
it
whole
is.
culture discussion about what we do to
Which is
ourselves.
part of what I'm trying to get people
Yep.
to stop is to stop
Yep.
being so busy and slow down and stop hustling so much. But again, I think it's easier to get an IV.
Yep. And I'm guilty of this myself. I'm in that category of people who just hustles 7 days a week
Yep.
nonstop, and I wear myself down. I mean, you'll kill your immunity, your immune system when you're doing that to yourself. And this is a great way to supplement that, whether it's on a weekly basis, once a month, before a big trip. High performance individuals need to do the self-care, and this is convenient. We've talked about being available at airports. That's a project that we're working on. Really
That's
being
a
able to
great idea.
meet people where they're at. I mean, think about it. You get off the plane, you just had a big business trip, you got an hour to kill maybe before you got to go somewhere. We can treat you and keep you healthy. So that's a project that we've talked about and are working on as an option because it's all about convenience, speed and convenience, and not sacrificing quality either.
Yeah.
So
Oh, I got more ideas for you. Okay, so baseball games, lacrosse and soccer tournaments. We are out
yep.
there all day long with those kids.
And that's exhausting.
Nothing to do. I know. Come give us IVs.
You'd be surprised at some of the roads we've gone down or talked to people about. Collegiate athletics, race car drivers, pit
Yeah.
crews, they're sweating away, and that's a long day. There's so many applications for what we do, both on the sick side and the well side, and it's just starting. I mean, it's
Yeah.
a relatively new thing, which creates a little bit of skepticism and uncertainty. And I'm hoping things like this where we talk about it and really the what and the how and, who it's appropriate for and all of that really helps educate people. I think there's a lot of education that needs to be done around this
I
still
agree.
to help people feel comfortable about it and understand why it's important.
And it's so, I mean, all of this, all of the things that I talk about, all of the quote unquote biohacking type things that are proactive to help you get and stay healthy, to have longevity in a healthful manner, not just I'm going to live long, but I'm going to live long cognitively and in a healthful manner. I think there's a lot of questions and skepticism around it because especially in some older generations, you were just raised to trust your doctor. You
Yep.
just go to the doctor and that's it. And whatever they say is what you do. And you shouldn't do anything else. And I love that we live in a world where you can do your own research and you can see, oh, wait, maybe for my body, because I'm different, I need something else or I need something more. And to that point, this is not covered by insurance. And I get that that is a sore point for a lot of people when I talk about, hey, you really should do this, this, or this. You should see an integrative doctor. You should get into some functional testing. You should do metabolic, all of those things. People say, oh, but it's not covered by insurance. And I always say, if you look down the road 20, 30, 40, 50 years from now, and God forbid you're sick from something and you could have paid out of pocket for some proactive measures to not get you to this point, you would have done it. We've got to be able to know that we're important enough to spend some extra money on.
It's interesting. So people are willing to throw $100,000 into a vehicle or buy $1 million home or buy a boat, buy all these things. But when it comes to spending a couple $100 or more on themselves, it's all of a sudden a bad investment. So it's interesting. Invest in yourself so you can enjoy all those other things. It's important. It's extremely important. One of the benefits of our services is even though it's not covered under insurance, so we can't bill, we can still accept HSA, FSA payments. I mean, most health plans nowadays have those high deductible plans. With a qualifying plan, you can have an HSA or FSA. We can accept that for payment. So our services are still considered medical over-the-counter services, essentially. So we are able to do that. So you get to the end of the year, you have to spend down some of that money. Think about us as a self-care option, especially going into the holidays, which is one of the most stressful and busy times of the year.
Yeah, absolutely true. Do you have like a club? Do you do like a subscription or is it all just one service?
Yeah, so we're working on that.
That's great. Do that.
Absolutely. I think it's important because we do have a lot of requests. We do have people that are seeing us on a weekly basis. We're working on some different membership options that includes
or buy a pack.
Or include some lab testing. Going back to that point, you can buy multiple at the same time. Especially with NAD, that's a big one. Doing one NAD treatment's not going to change your life. It's not going to boost you forever. That really needs to be part of a treatment plan. That's a regular basis every 30 days or so. Again, testing is important, but, it's not a once and done. That's one of the things a lot of people come to me, they say, I want to try it. It's like, okay, you can try IV therapy, but unless you're severely deficient in something or you're sick, you're not going to all of a sudden experience these superpower results like you're going to fly or you're going to run faster or anything like that. I mean, this is an ongoing wellness modality that you need to do on a regular basis, especially if you're doing it for proactive reasons.
Yeah. But I will say that very first time that I had it, when I was starting to feel like something was trying to get me, the same thing that had my kids, the next day, gone. Like I was like, wow, I am superhuman.
Whenever my mom travels now, she's like, because she lives in South Carolina, we're not there yet. I'll say yet. She'll come up to the area and she'll say, can I get treated? I'm going on a trip. I don't want to be sick. Inevitably, she hasn't been sick. So, take that for what it's worth. You've had that same experience. There definitely is immune boosting capabilities with what we do.
So 2 questions that I ask everybody at the end of every podcast. First, what are your personal non-negotiable health practices?
Yeah, I think one, I don't drink. That's a big one for me.
Bravo.
Because that will age you considerably. A drink here and there is not a problem. I don't want to make it sound like that's a problem. But that's a big one for me. Exercising every day. A lot of people say, why don't you take a rest day? It's like, okay, well, I consider a rest day going for a weighted vest walk with the dogs. That to me is a rest day. But for me, it's consistently staying active. I try to get at least one workout in a day, sometimes two. The body was meant to move. The body was not meant to sit still. I think chairs and couches are, one of the biggest crimes to humanity because a lot of people overuse them. There's a time to relax, but the body was meant to move. So get up and move. And that's how I really stay healthy. I'm a huge cold plunge sauna person as well. So for all the people out there
Maybe
that are
we were friends.
2 to 3 days a week, I do contrast therapy, kind of going back and forth between the sauna and the cold plunge. I do compression therapy on different parts of my body when I'm sore. So I'm big into the recovery stuff. That's big for me. So those are non-negotiables. And obviously a healthy diet. I'm not perfect. I like pizza. I like pasta, those things. But, I really try to dial in what's best for me from a diet and nutrient standpoint. So very focused on that.
Which vest do you walk with?
A 40-pounder.
40, but who?
Got it off
By who?
Amazon. I got it off Amazon. It's like
Fantastic.
Run Max or something like that.
Okay.
But, one of the things that I enjoy doing is doing trail running. And I've done ultra marathons in the past. I'm too busy now because I'm running a business, but I'd love to get back into it. I use that because if you can run with an extra 40 pounds on you or walk with an extra 40 pounds, it makes doing without it a lot easier. So,
no
it's a
kidding.
trick I learned from some experienced ultra marathon runners is do a lot of weighted vest walks. So that's a big one.
Hey, pro tip, you can do weighted vest while you're doing housework.
Absolutely.
I love my weighted vest. I use GoRuck. I'll drop a link in for everybody, but truly use it whenever, and you don't have to run with it. I do a 30-pounder and I don't run with it. You're pretty hardcore, Dan, but it's great for posture. I mean, there's so many benefits.
Absolutely. Increasing bone strength. I mean, it just really exercise in general, but doing things weighted, doing things that are difficult really help with longevity big time.
Yeah. And a word about the couches and the sofas and the things like that. When you look at some of the healthiest countries, they sit on the floor a lot. They have a lower instance of hip replacements and knee replacements. They're sitting on the floor. So try that. Like, that's one thing you could take away. I think you all should go get IV Active. The links will be all here for you. We're going to give you a discount code, all of that. But one small thing you can try, sit on the floor a little bit more today if you're going to sit. That's a way to improve your health.
Absolutely. Here's the thing, get out of your comfort zone. That's when people say to me, what's one thing I can do? Just get out of your comfort zone. I don't care what that is. If you're not a runner, try running. If you're a runner and you don't lift, try weightlifting. If you aren't a reader, big one for me. I was not a big reader. And then I challenged myself to start reading for my own brain health. And I started reading and I fell in love with it. I have to give my wife credit because she got me into reading, and I spent 30 some years not being a reader. Now I'm a reader, and I feel like it's just good for me. It helps with healthy sleep too. That's another thing about people that have trouble sleeping. No blue light, no TV, no phone before bed. Read a book.
Nope.
Fall asleep with the book on your chest, and you'll experience an amazing difference in your sleep. I'm a big sleep tracker too with my Garmin watch. So I know my quality of sleep, and it's always better when I read before bed.
So good. And then final question we ask everybody, and I probably know the answer to this. What's one thing that everybody could do to help reduce their stress, in your opinion?
Oh, I think this is a quote that I absolutely love. So stress is inaction over things that you can control. So one of my biggest pieces of advice for people is, instead of sitting there stressing and worrying about something, take action on it. If that's your health, get out and exercise. If that's your job, you could go find another one maybe, or make some changes in how you approach your work. There's a lot of things that you can do. A lot of people, stress and anxiety is really from just not taking action on things and just worrying about them. There's a lot of other causes, but that's a big one for me, is like, when I start feeling myself get stressed out, I ask myself the question, do I have control over this thing that I'm stressed out over? And then if the answer is yes, I take some action on it. And you'd be surprised, even if the action doesn't get the result you want, you're going to feel better because you did something about it. Now you have a little bit of control. So that's my biggest piece of advice on stress.
That's wonderful. I feel like I need to make a coffee table book with everybody's answers to that question. once I get to
I
like
stole
200
that quote
episodes.
from, I think it's a Jeff Bezos quote, by the way. So I stole that one, but I'm a big, like, I bank quotes in my brain that I see that I'm
Yeah.
really fascinated by and that speak to me. So when it's appropriate, they come out and, it helps me keep things into perspective.
All right, give us the rundown. Where can we find you, Ivy Active? Tell us.
Absolutely. So we're on the web. So iv-active.com. So that's our website. We're currently going through, by the time this comes out, we may have a new website, but there's a lot of information on there. All of our treatments are on there, how to book, how it works, all that stuff. We're on social. So you can go on to Instagram and Facebook, just search IV Active. You're going to find, a lot of our stuff, videos that kind of show like, okay, application for treatments or, a little bit about our nurses is on there. So you can find us there as well. If you have any questions whatsoever, you go on the website, you send us a message. We're quick to respond. We want to help and we want to educate. And we do have a lot of plans to set up some educational events and things like that, around the areas that we're in. So, yep, that's where you can find us and we want to help.
You have so generously given us a discount code. It's BeWell10 for 10% off. The link and everything will go in the show notes, but BeWell10 in order to get 10% off. And I really highly recommend, if you're in this area in the Northeast and you can do it, give it a try.
Yep. And we're expanding. So if we're not there today, we might be there tomorrow.
Yeah, that's the goal, to get everybody well. Dan, you are a wealth of information. This was a great conversation. Thank you so much for your time.
Absolutely. Thank you, Kerstin. And I just want to tell everybody out there, stay active.
So in the studio next, I have Kim Gravel. You probably know her from QVC. She also had a reality show. She has this amazing brand. She's written books. She has a podcast. She's a mom. She's a Southern belle. We get real serious about health, her weight loss journey. We talk about her struggle with Bell's palsy. We talk about how the Lord has spoke to her. And you better believe, because it's Kim Gravel and Kerstin Lindquist, that there is some preaching going on. It is a wonderful episode of StRest, and it's coming up next.
If you're enjoying the show, don't forget to subscribe and leave a review on your favorite podcast platform. Your reviews help others find the podcast and join our community. Follow me on social media at Kerstin.Lindquist for daily tips and inspiration. And visit my website at www.Kerstin-Lindquist.com to sign up for our newsletter and receive exclusive content. The information provided in this podcast is for informational and educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The host of this podcast is a certified health coach and medical researcher, not a licensed medical professional, and the content shared does not constitute medical advice. While we strive to provide accurate and up-to-date information, we encourage you to do your own research and consult with your healthcare provider before making any changes to your healthcare treatment plans. Thank you for joining me on this journey to reduce stress and make room for rest. Remember, you're not alone. Keep coming back, share your story, ask for help, and give yourself grace.